Hello, everybody. This is Mr. Brown here to talk a little bit about our first aid CPR stuff that I just sent out. I just wanted to kind of go over a couple things that you'll see on the PowerPoint and in the video in detail, specifically some of the first aid stuff, and then just general rules surrounding first aid CPR, because this is one unit I really like to do in person because we can demonstrate and go over a lot of different things and answer a lot of questions about a lot of different scenarios you may be in. But obviously, we can't do that, so I wanted to give you a little more information on that, because you never know when you're going to be in a first aid situation. I mean, those of you who live with younger siblings or have older grandparents, or I mean, it can happen to anybody, right? Um, Heart failure happens all the time. People break their arms. People cut themselves really bad. So especially the teenage population. Behind driving accidents, the number one cause of death for people, in the teenage high school age group is accident related. So, you know, it's just the nature of the beast that 16 to 21-year-olds like to engage in risky physical behavior, and so they end up in first aid situations a lot. I mean, I know I've broken plenty of bones and had a lot of stitches in my body, and I know some of you have too. So it's important to know how to take care of yourself. This is one of those real world application things that's very important. So I'm literally just looking at the PowerPoint I sent out and just kind of going to go through some things. Start at the top with basic info. Evaluate the scene. So this is what I'm going to spend the most amount of time on. There's a lot of times when people are in danger or are hurt, but it is not appropriate for you or someone to come in and try and save the day. Let's look at a few of those. If there's a car crash on the side of the road, and let's just stay with that. If there's a car crash on the side of the road, what are some possible hazards that might be in play there? Okay, well, one, other cars. I mean, if you're on the side of a busy road, you might not want to go run over there because you don't want to get hit by a car yourself. Two, is there oil leaking out of the car? What happens to oil when it leaks onto the ground and then a spark ignites, right? An explosion or a fire. Okay, what else? Is there downed electrical lines? Is it raining? What happens if you're in a puddle and there's an electrical line sitting there, right? You can get electrocuted. There's all kinds of things. Is the car in park, or can it roll away? There's a lot of things to look out for. So evaluating the scene and understanding any risks is really, really important. Let's talk about blood. Okay, if you walk up to a scene and someone's bleeding and there's blood all over the place, you need to take precautions in order to make sure you don't contract a bloodborne illness. So, rubber gloves are always important. Covering your mouth and your nose. If you have any open wounds, those are all ways you can contract bloodborne pathogens from other people. Okay, so it's always important to evaluate the scene and make sure you don't put yourself at risk when you're going to help someone else. Another point on here, it says do a head to toe check. Okay, if someone's laying there and you don't see blood, does that immediately mean they're not hurt? No. Spine, head, or neck injuries, you don't see them all the time. Okay, if someone's been in a car crash or they've fallen, okay, you don't know if they hit their head. You don't know if they tweak their neck a certain way. They could be laying there unconscious and have a vertebrae, dislodged, or something's threatening to pinch their spinal cord. And if you pick them up and drag them off to the side, you might finish the job there and really hurt them. And you don't want to be responsible for that. Internal bleeding, okay? If someone gets a really bad bruise, if they get hit somewhere, especially somewhere around their lower extremities or in their abdomen where there's a lot of vital organs, they can be bleeding internally and you don't actually see that, okay? So that's something to be aware of, right? It's not always a finger pointing sideways or an ankle bone sticking out or blood everywhere, right? There's things that can be going on inside the body that you need to be aware of. let's see if there's anything else here. Oh, one other thing I wanted to talk about. It's called the Good Samaritan Law. Okay, so the question comes up a lot. If I'm driving down the freeway and I see a car pulled over and it looks like they've been in a wreck and I don't see anyone helping, should I pull over and help? Okay, well, there's a lot of things to think about there. One, you never have to. Okay, you never have to. It's a scary situation to be in. There's no law saying you are required to pull over and help that person. Now, if you feel inclined and you feel like you should help, go ahead and do so. The Good Samaritan Law kicks in when it protects you. If you go over to administer regular first aid or CPR, as you have the ability or knowledge to do so, if you just act within the means that a normal person would in a first aid situation, if the person ends up dying or they end up being injured, or something happens, you are protected by the Good Samaritan Law as long as you act within your own means. So if you go over there and, there's a car that's dripping oil and there's a person laying underneath it and it's about to explode, and you grab them from behind the armpits and you drag them out of there and you end up breaking a rib in the process, okay? That person, that victim, cannot come after you and sue you for breaking their rib because you did what any normal person would do in that situation, which is go and try and get them away from the car that's about to blow up, right? So that the Good Samaritan Law protects you in that scenario. CPR, sometimes ribs break in CPR, right? You'll learn later that you have to get 1.5 inches to 2 inches deep into their chest with each compression. On older people with more brittle bones, ribs can break. Okay, the Good Samaritan Law protects you. Here's where the Good Samaritan Law does not protect you. If someone's passed out, maybe they don't have a pulse, and you watched, Grey's Anatomy the night before, what other, name another doctor show, okay? And you pull a pen out of your pocket and you try and do one of those tracheotomies or whatever they're called, where you poke a hole in their throat to get the air out and to let them breathe, and trying to save their life. No, that is not within your means. You are not a surgeon. You can't do that. You can't take out a pocket knife and try and cut them open and perform open heart surgery if they're laying there unconscious, because that's not within your means. Now, if you're a heart surgeon, or if you're a medical professional and you could do some things, okay, that might be within your means. But the average person, me included, I'm not going to go over there and try and cut open somebody to try and save their life, right? I'd rather call 911, do CPR, administer any first aid that I can, and not really do things that I'm not comfortable with, right? So the Good Samaritan Law protects you as long as you act within your means. But that being said, don't do anything you're not comfortable doing, okay? Let's move on. Bleeding cuts, okay, there's 4 different kinds of bleeding cuts there. I'll just go over this real quick. A laceration is kind of a deep cut, the one you think of when you require stitches. A puncture is like a stab wound, or if you get poked by a thumbtack or something, right? An avulsion is when there's skin hanging off. So if you really skinned your knee and there's a flap of skin hanging off, that's an avulsion. And then an abrasion is like a rug burn, or like a cheese grater type effect, right? That's an abrasion. And then the one that I didn't put on here that is part of it is an amputation, where a part of your body is completely removed. And then an incision is surgical. But the 4 there in yellow are the ones you need to know about, okay? The big thing with bleeding, okay, is apply pressure to the bleeding. Use a part of your shirt. We refrain against using our own hands because we don't want skin-to-skin contact where there's blood present. So find some sort of cloth material, preferably not something super rough, and apply pressure. You can even wrap it around and tie it if you need to in order to stop the bleeding. Okay, obviously if it's something real small, a Band-Aid usually works. But what should you do before you cover any wound? You have to disinfect it, okay? Even cool water over it is better than nothing, just to get any debris out of there. Antibiotic cream is even better, disinfectant cream, okay, and then a Band-Aid. But you can't trap dirt or bacteria or gross stuff inside a wound, because then it will become infected and you don't want that. Okay, so that's a little bit about bleeding. bruises, sprains, potential breaks. Okay, someone rolls their ankle, someone falls out of a tree and lands on their arm. Okay, you're playing basketball and you hear your knee pop. Okay, if it's really bad and the person's having a lot of pain and a lot of trouble, you need to get them to the doctor. Or if it's really, really bad, you might need to call 911 and get them emergency care. But for your everyday bruises, sprains, or potential breaks, okay, RICE, RICE is the acronym. Rest, ice, compress, and elevate. This is all meant to just decrease inflammation wherever it is, and to prevent it from blowing up and causing even more pain and lack of mobility. Okay, I posted a little YouTube link on there if you're in a pinch and you need to give someone a splint. Okay, just take something solid, and you really want to immobilize, meaning keep stationary the joints around the area of injury. So let's say you really hurt your forearm. Okay, what are the joints on either side of my forearm? It's my elbow and my wrist. So I need to find something solid that runs the length of my wrist, forearm, and elbow in order to prevent me from being able to move my forearm. Okay, let's say I hurt my wrist. What would I do? Well, if I hurt my wrist, I want to immobilize the bones on either side of the joint. So what are the bones on either side of my wrist joint? My hand and my forearm. So you would need something solid that runs the length of your hand down to your forearm so that you can't bend your wrist. Okay, that's kind of the basic knowledge there. Let's move on. Shock. Shock can come from a lot of different things. Gunshot wounds often lead to shock. Something that is so severe and so catastrophic and so traumatic that the person who experienced it mentally goes into a state of shock, right? They might not feel pain. I always tell a story about a teacher I used to work with who was riding his bike down a mountain pass and crashed going 45 miles an hour into a guardrail and snapped his femur, which is your long leg bone. Now, that's like the most painful break you can ever do, and he went into shock. Didn't feel any pain. He was very disoriented, but was able to make his way back to his car and drove home 2.5 hours. Well, about an hour and a half in, the pain hit him because the shock wore off and it was excruciating and he had to pull over and call 911, right? So shock can actually delay pain, but it's not a good thing because it slows your heart rate down. It makes your mind kind of clouded. You don't think straight. So shock is a very serious thing. You can get anaphylactic shock if you're allergic. If you're allergic to bees and you get stung by a bee. If you're allergic to peanut butter and you ingest peanuts, right? That's anaphylactic shock. Severe injury, poison intake can lead to shock. The recovery position. Okay, I put in a little video there about how to put someone in the recovery position. Basically, on their side is the most important thing, right? We've all slept in bed before like this on our arm. Okay, that's kind of what we're going for with the recovery position so that if they do vomit, it's going out the side and they're not going to choke on it. Okay, so that's the main thing there. Burns. You have your different degrees of burns. Okay, first degree is kind of just a bad sunburn kind of thing, or if you accidentally touch a hot pan for just a quick second, it leaves a little red mark. Okay, that's a first degree burn. Second degree burns one that leads to blistering. You can get a sunburn that leads to a second degree burn if it starts to blister. This is a little bit more prolonged contact with something real hot, right? And then a third degree burn is the one that damages the actual tissue and will end up scarring pretty bad. So if you catch on fire, or if, I've heard a few students tell stories about younger siblings, or even them when they were younger, and there's hot oil on a stovetop and they're little, so they're below it and it tips on them. Right? It's really gruesome to think about, but that's the kind of thing that can lead to a third degree burn, is very prolonged, really hot surface exposure. With burns, don't pour running water on it because that can tear up skin. It can rip skin off. You don't want to apply anything with adhesive to it. No Band-Aids, no tape, because what happens when you pull the tape or the Band-Aid off? That burned skin, right? A cool cloth with a really smooth fabric. You can apply it, but don't rub it. Just apply it and then wrap it up. Plastic wrap works really well because it's not sticky. Grocery bags even work okay, but wrap it up so that it can't be exposed to the outside environment because then it can become infected. So that's a little bit about burns. Choking. Okay, you're actually not allowed to call the Heimlich maneuver anymore. It has to be called abdominal thrusts. Um, it was a copyright issue with the Heimlich family, I think. I'm not even kidding. Um, if someone's choking, the universal sign, let's see if I can set my phone down here. The universal sign for choking is two hands right here. If you see someone doing that or you are choking yourself, that's what you do. Okay? First thing is give them back blows. Okay? Take the butt of your hand and like you're burping a baby to see if they can cough whatever up is choking. Actually, let me backtrack. Before you even do that, ask them to cough or speak. If they say they're choking and then you say, okay, try and cough, and they go, and they cough, right? They're not choking. They got something stuck in there, but they're not choking. If they can get air through, let them work it out. If they can speak and it's not like if they can actually get words out, they're fine. Let them work it out. Okay. Obviously, if it gets worse and they lose the ability to cough or speak, then you jump in. But first, ask them that. Then do the back blows. If that doesn't work, abdominal thrusts are what you do. Okay, I'm gonna set my phone down again. Okay. Pretend like you're playing rock, paper, scissors. Okay. One hand on top, making a fist on top of a hand. Turn it inward. Okay. And you're following your sternum, which is in between your chest muscles, down to hit that little soft pocket right above your stomach. Okay. You want to put your fist right in there. Okay. And you're standing behind them, and you want to pull up and in. Okay, forcefully, right? You need to do it forcefully to try and dislodge whatever's stuck. We can talk, if you have questions about how to do abdominal thrusts on an infant, we can talk about that. But if you need to get down on a knee because this person's really short, do it. If you need to stand up on a chair because they're really tall, do it. If you're by yourself and you're choking and there's no one around to give you abdominal thrusts, find a countertop, a desk corner edge, a coffee table edge, anything that has a sharp point, and force yourself into it like you're doing abdominal thrust with that, with whatever that corner edge is, okay? That's how you help dislodge it from your own body, okay? After someone is relieved of choking, okay, you can put them in the recovery position. If you can't get out whatever is in there immediately, you need to call 911, okay? You need to call 911. Heat exhaustion and heat stroke, very common, okay? A lot of athletes or even, non-athletes experience this in the hot months. If they're out, swimming and they aren't drinking enough water and they're exposed to the sun all day, right? You can get heat exhaustion or heat stroke. I have on there how you should treat it, okay? But really the way to avoid it is make sure you're drinking enough water and staying hydrated, and make sure you're not, you're paying attention to your own symptoms, right? If you start to get lightheaded or a headache or nauseous or your vision starts to go blurry and you're in the heat, that's a sign of heat exhaustion or heat stroke. And then last one we're going to talk about is seizures, okay? There's a good chance if you haven't already been around one, you're going to be around a seizure in your life, okay? There's different kinds of seizures. There's kinds where, someone who's having it might just have a little tick, or it might be a very, very obvious, on the ground convulsing seizure, okay? The biggest thing to do is stay calm. It's a very unnerving thing to see someone having a seizure, but you have to be poised and stay calm in order to help that person out. Now, people who are having seizures, they know what's going on, okay? And it's often very embarrassing for them because they know what's happening. They see everything happening around them. They literally just can't do anything about it. A lot of times they'll lose their ability to control their bladders or their bowels, and that can be very embarrassing. They know that it looks, kind of weird, right? So it's an embarrassing thing. Never try and constrict someone who's having a seizure, okay? Imagine being tied up with a rope and you're trying to break out, okay? That's what it would feel like, someone having a seizure and you trying to constrict them, okay? Let them go. The big thing is to protect their head. Get behind them and hold it with two hands to prevent it from thrashing into anything. Do that. Just protect the head. If there's a biting tool, some people who have seizure issues and have seizures all the time have a little rubber biting tool on a necklace. Put that in their mouth and they can bite down on it, because one thing that happens a lot with seizures is they'll bite their own tongue really bad, or even swallow their own tongue. If it's really bad and you don't know the situation, you don't know the person, and it lasts for more than, a few minutes, call 911 and stay with the person. And anytime someone has finished a seizure and is done, put them in the recovery position, because a seizure is a very, very tiring thing. Their muscles are contracting nonstop for the entire duration of that seizure. So when we're in class, I like to tell you guys, okay, everyone try and flex every muscle in your body for 20 seconds. It's really hard to do. Now imagine doing that for 4 minutes or whatever it is. That's how long those people are flexing their muscles without choice when they're having a seizure. Okay, so it's really tiring. So make sure that you put them into the recovery position when they're done. That should help out with your first aid stuff and give you some information. A little bit about CPR. The videos do a good job of covering it, but the big thing is to stay calm and not to rush it. Okay. Make sure you're following all the steps. Make sure you activate EMS. Okay. Make sure the scene is safe. Okay. The skill cues, right? When you're giving chest compressions, is to always make sure that your elbows stay locked out. You never want to bend your elbows and do CPR like this. You want to lock them out and use your body. Okay. You want to use the butt of your hand, and you want to put it right in the middle. Not over here, right in the middle of their chest. Okay. And you have to compress. You have to go down 1.5 inches to 2 inches in order to actually make an impact. Okay. And the other thing is rhythm. Okay. You always, we play the song "Staying Alive" in class. The stay alive. Okay. That's the tempo you want to go, right? It's the 1 and 2 and 3 and 4 and 1 and 6 and 7 and 8. Okay. So make sure you're going at a rhythm. Okay. We don't want to dun 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 all over the board. We want to be in rhythm. Okay. When we're doing CPR. The video should help you out with CPR. If you have any questions about it, let me know. And if you're interested in learning further CPR, reach out to me, and I have ways that we can get certified, or you can learn infant CPR or things like that, and we can get that moving for you. And you can actually get certified and get a CPR card, which is pretty cool. So pay attention to those videos. I hope I gave you all the information you need on CPR. Use the PowerPoint and get that first aid CPR worksheet back to me by next Thursday. Okay, thanks guys.